Good day. I'm your host with the most important information about nurses. My name is Lavas Pamire. Today we're going to talk about aptitude and adaptation. So, what is it that we are talking about today? This is the information most of the nurses have been asking me to present or to help them or to guide them with. So, this information is about those who are relocating or wants to relocate, or those who are yet to make a decision as to which program they want to really undergo or undertake when they're here in Ireland. So you can either do adaptation, that is on job training, or you can do RCSI or Aptitude. RCSI, that's the Royal College of Surgeons in Ireland. So you can either do the test that takes about 2 days, or that is done in 2 days. They can separate probably with a week, but you can make a choice whether you want to do the aptitude or the adaptation that takes about 6 to 12 weeks. So we'll talk about that in detail. Right. So adaptation is on job training, like I said. So what then happens when you have acquired a job, your agent will either tell you that you're going to do adaptation or aptitude. It is also your decision to choose to go for aptitude or adaptation. You can tell your agent what you want, and the agent can also be told where you want to work, whether you want to be in the capital city, Dublin, or in the outskirts of the capital city. It depends with your choices and the reasons that you want a certain place over the other. So let's talk about adaptation. Like I said, it's on job training. And before you commence the actual adaptation in the ward, you go through what is called an induction program. An induction program can take about days or two. It can also take up to 2 weeks, a day, 2 days, even up to 2 weeks, even more. It depends with the policy or how the hospital wants you to go through the induction in terms of time frame. So on the induction, you are actually given information. You are given orientation on how to work in the ward. So there will be like mimicking situations, how to use the machines, how to go through, how to use the charts and the documents, and how to do everything that is expected of you. Admitting a patient, how do you admit a patient? What kind of documents do you need? If it is diabetes, what kind of information do you need? How do you check somebody's glucose, sugar levels in the system, the machines, and how they work in general? And you are trained also during that period. You can do some certain courses as well, like BLS, just to keep you abreast of what is expected of you in case that you encounter an emergency. So there's a lot that you have to learn. So now let's look into the stages of adaptation. So adaptation basically is about 3 stages. There's what we call the initial meeting. After the initial meeting, you go through the intermediate meeting, and then finally the final meeting. So what is the initial meeting about? So the initial meeting is when you're starting now to work in the ward, or to work in the department, or it could be theater, it could be ICU, depending where you'll be working. So on that day now, you are given orientation in the ward and what is expected of you. You're given a booklet, sort of a care plan upon which everything is laid down. The domains are also there, what we call domains. There are about 6 domains of competence that you'll be assessed on. So on these domains of competence, you will be assessed how you are doing on each and every one of these domains. So on the initial meeting, you are being outlined, or you are outlining the areas of need, the goals, and what you should be able to achieve at the end of the day as a candidate nurse. So during adaptation, during the adaptation period, you're called a candidate nurse. So on the initial meeting, you sit down with your preceptor. So a preceptor is a senior nurse who is assigned to you to take you through the period of adaptation. You can be assigned 2 or even more preceptors. Or even if your preceptor is not there working with you, you can be assigned a senior staff nurse in the ward. Or if you are many of you doing adaptation at the same hospital in the same ward, that same preceptor, one preceptor can also help the other. And there'll be a lot of signing. You will be told how to go about it. In the booklet, the care plan, the book plan that I told you about, you need to sign various procedures and everything that you'll have done. Make sure that it is signed for, because it will come handy at the end of the day when you are coming nigh to completion of your program. So then after the initial meeting, you will have what we call the intermediate meeting, which is done between 3 to 6 weeks. That will be really assessing your progress, how you are doing, how you're faring up during the adaptation program. If there are areas that you need to work on and improve on, you are actually given information or told by your preceptor that you're still lagging behind on 1-2 areas. So you will be able to work out those areas. If the preceptor also, or the clinical facilitators rather, the clinical facilitator is a shadow manager or looks overly in charge of all the students or candidate nurses doing adaptation. So she'll be in charge giving guidance and direction as to how the adaptation program is going. So she will be or he will be also working together with these preceptors. So they will do everything for you, making plans for you, giving you information and support that you need in order for you to do well during the adaptation period. So the clinical facilitators also can provide you with performance improvement plan. If you're not doing well in certain areas, they do what is called performance improvement plan, work out some plans. If it is the area of medication, they're not doing well, you're given information to guide you, to help you. It could be policies and procedures to guide you through. You can also do some courses on HSE Land, which HSE Land is a platform whereby you have to do certain courses to improve your knowledge and your understanding on a certain area or is required. You can do HSE Land is required by the hospital even way after you've passed your adaptation, or even before. The agent can tell you to do certain courses on HSE Land before you even travel to Ireland. Then after the intermediate meeting, you do the final meeting, which takes place between 6 to 12 weeks. This is the time you can be rendered competent or incompetent. If you're competent, then you are signed off, and soon after you are signed off, you then have to apply for your NMBI or register with NMBI so that you're able to be given your PIN, and you will be called a qualified staff nurse. But if you are incompetent, then you will not be able to be signed off or be able to apply for your PIN with NMBI. So candidate nurses, you have to keep a booklet, like I said, that you'll be given a booklet, and you need to keep it safe and get procedures signed off for you. So in adaptation, there is no second chance as compared to RCSI. You're only given a chance during the 6 to 12 weeks. However, if for any other reason, the preceptor, the clinical facilitators, have found that you still need to proceed, or there could have been disturbances, or they still feel there's a chance for you to do well during the adaptation period, they can extend it. They will apply to NMBI for an extension, and that can be extended. So you can go beyond 12 weeks of the prescribed time of doing adaptation. So that's information about adaptation. Let's go into aptitude, or RCSI. What is it about? What is expected of you? However, before I go to aptitude or talk about RCSI, I just want to highlight a few points to guide you when you're doing adaptation. Adaptation basically is not examinable in a way that you write an exam and you either failing or you either fail or pass. But this is basically an assessment by the preceptor, how you are faring up. The preceptor is the one who judges you, or who will make you or render you competent, together with the rest of the other nurses that will be working with you in the ward. So what is very critical in adaptation is your attitude. You need to have proper and positive attitude, positive energy, be enthusiastic, be a learner, be willing to learn. Don't pretend to know something. Ask questions. The most important thing in adaptation is to ask questions. Doesn't matter how silly it is. Of course, there are some who might be irritated by your question, but it is important for you to ask questions. It doesn't matter what kind of question you are asking, but the fact that you want to know about something, it shows, or it means you don't know about that thing, or you are not so sure about that thing. So you need to ask questions and get clarity. All right, just like when you are testing for blood sugar, and if you don't ask which really strip to use, because you can use a ketone strip instead of a glucose strip, for example, and you can make a huge error, because if you continue to make mistakes, this will come handy at the end of the day as part of your overall assessment and how you're performing, because what they need to do at the end of the day is to render you competent by assessing how you really fared up during the time of adaptation. So you need to show willingness to learn. You need to be a good communicator. You need to communicate well with the staff, the patients, and be able to be a good nurse, basically, because there's no one who would want to work with a bad nurse, really, and be just a good nurse. And let's talk now about aptitude, or RCSI. What is it that you need to know? Okay, so in aptitude, really, it is an examination that you sit for, that will prepare you. You have to prepare yourself for the aptitude test, because there is quite a lot that needs to be known by you, the nurse. So where do you get this information, or how do you go about it? Now, when it comes to aptitude, you need to understand the website, the RCSI website. It is quite a lot of information, and some topics also are updated on the website. So you need to understand, to be acquainted or to be well versed with the website, because there's certain information that can change from time to time on the website, and this will come on the day of examination. So you need to be conversant with the website, be able to read it large and wide, so that you are able to grasp everything. Make notes if you can. short notes, because on the day of examination, okay, you have 2 days basically. The first day is theory. You write a theory test, which is a multiple choice test, really. About 150 questions that you need to answer in it, and you need to pass at least 50%. So that's 75 out of 150. That's your pass mark. So you do not have to worry much about the theory test, because as you're practicing, as you're reading the website, as you are doing the stations, the practicals, you are also preparing yourself for the theory test. Of course, it is important for you to go through the theory test and see how it is like, and also practice and be able to answer the questions that are provided there and see how you are performing. But most importantly is for you to read the website and be able to go through the website and understand it in and out. So there are what we call 14 stations that you need to then answer on the day of your practical, the second day of your test. So it's either you do the theory on a Saturday and the practicals on a Sunday, or you can do it this week, Friday, Saturday, or this week, and the other week you do the second examinable aspect of aptitude. So that's what is very important. So on the day of your theory, you can put on your usual clothes. You don't need to put anything special. Just wear the way you're comfortable on the day of theory. But on the practical day, you need to put on a scrub. So put on a scrub on the theory day, so that you are able to, it doesn't matter the color, whatever scrub you can put on the day of your aptitude practical, it doesn't matter the color. So one of the most important thing is to be on time. Be on time, and so that you're able to relax and be flexible on the environment that you're working there. And the other thing also that we need to look into is be a good listener. So you need to listen to the instructions that you will be given on the day of your aptitude test. Don't be too confident, okay? Don't be too confident. Don't be too overzealous. Just be calm and collected on the day of exam. All right. So we'll be talking more deeper and deeper on some of these topics, or on aptitude and RCSI. There's a lot that we can unfold, we can dissect, we can really look deeper into, and to be able to help each other. I'll leave you guys for now. If you have any questions, please write in the chat box, and I'll be willing to respond to your questions. Meanwhile, please subscribe to my channel for more, and put on the notification button that when I upload something, you'll be able to be notified. Okay, it's a bye-bye for now.